You recall the lead water crisis over in Flint, Michigan, right? But a new report says the children of Milwaukee, Wisconsin are also at risk. A state report says a lead poisoning prevention program failed to take even basic steps to protect children there. According to Wisconsin's State Department of Health, 108 lead poisoning cases were opened, and over 90% of those cases were closed before blood lead levels dropped to what is deemed safe. It goes on to say that the city's basic protocol for investigating cases doesn't even comply with state law. Milwaukee's Mayor Tom Barrett has until the end of the month to come up with a plan to fix the problems. Milwaukee must also go back and review all 491 cases to make sure children received proper care. So for more on this, we're turning now to Wisconsin State Senator Lena Taylor. Ms. Taylor, thanks for being with us today. It's good to see you again. Can you tell us in your words what you feel is happening in Milwaukee with this lead water problem?
I think the lead issue in Milwaukee is at epidemic numbers. I think it is truly a sad example of nothing really being done to address the issue, and people knowingly moving forward and trying to act as if they didn't know. And moving forward with no action and acting like they didn't know.
And I'm glad you brought that up, because the former health commissioner, Bevan Baker, has resigned after an internal investigation into this lead poisoning prevention program revealed that between 2015 and 2017, employees in his department failed to keep records of whether or not some of these families were affected by the lead poisoning, if they've ever received follow-up services. Do you hold him accountable for dropping the ball? And what can be done now for the families who are left kind of hung out to dry?
So let me be clear. This problem has existed since 1991. So yes, Bevan Baker did resign. He resigned because he was asked to resign by leadership that he worked for. The mayor was aware because the mayor was elected at a specific level of government within the state of Wisconsin in 1991 when the EPA first told us we had an issue. We then failed multiple tests after that. This has been an ongoing problem. When Madison chose to move forward with lead laterals and replace them, Milwaukee chose to coat them. Milwaukee coated them, and it has not given us the results that we need, which is why our numbers are the way that they are. So yes, there is enough blame to go around for Mr. Baker, for the health department, but more importantly, for city leadership and for state leadership, to be very candid with you.
And what parts of Milwaukee is this happening in? What part of town?
So it really is happening in multiple places in Milwaukee. It is concentrated in a southern portion of Milwaukee, and it's concentrated in a northwestern portion of Milwaukee in very high concentrations. I think the larger piece is wherever it is, the problem is lead poisoning is permanent. So the fact that there is knowledge, the fact that there is a lack of movement and an action plan that gives immediate results is troubling, because these are problems that people will have for a lifetime.
Do you fear that this is another Flint just waiting to happen?
You know, it's funny that you say that. We had the issue at least 15 years and identifiably before Flint had the issue. The other thing is Flint's issue is its water source. Our issue is no matter where we have water from, it has to go through the infrastructure that creates the challenges where the lead in turn will then be in the water. So that infrastructure of the laterals, that infrastructure in the homes, that is really the larger issue that we have. And very candidly, this is something that urban centers and rural centers, but especially around the nation that have infrastructure problems, should be looking at and be concerned about.
Yes, that's a really interesting fact to point out, that it isn't a source problem, that this exists within people's immediate homes and the pipes that are directly affecting these families. So the state of Wisconsin has now given Milwaukee until the end of June, June 30th, to develop a comprehensive plan of action. Give us a sample of what that plan might look like if it were up to you.
Well, I think, first of all, the state has to take responsibility, too, and not just say that we did something through the DNR by allowing federal dollars to be used, but we need to make our own personal investment as the state of Wisconsin to say that we're committed to the issues. So we could use the industrial hemp pilot program that we're doing to make hemp filters and to create a workforce and a product in that way. We also should make sure that those individuals that we know, for example, in the report that tested at 24 parts per billion and higher, any parts per billion above 0 is a problem, but 24 parts per billion is crisis and deserves immediate attention, that we're addressing those people and that we're following up and making sure that those connections have been made. But more importantly, we need to get rid of the lead laterals and get rid of the infrastructure that is contaminated. That needs to be an immediate plan of how we're going to do that in the same way that Madison did. In Milwaukee and other areas of the state that very candidly have high numbers also. And then lastly, we need to educate people and we need to create a pipeline for people to be trained to know how to do this work, for us to make products that can be used for this work so that we can more efficiently and effectively solve this problem using the government revenues that we have, both at city, county, and state level.
Does not sound like an easy one and done thing to do, but you guys are working on it. We will have you back on to talk more about this as the story unfolds. Thank you so much for sharing that with us. Wisconsin State Senator Lena Taylor, thank you so much.